flight. Why is it that the
and testing systems time and understand the severity of this outbreak? I'd like to thank everyone for doing the right thing. Our roads are clearly quieter. Many people are staying home, limiting contact and reducing the ability for the virus to spread further. This is exactly what we wanted to achieve. It's clear that we can count on West Australians to do the right thing when it comes to COVID, especially getting tested. I'd like to thank everyone for their patience and understanding during these challenging times, especially with travel restrictions between Perth and Peel and the rest of the state. At our vehicle checkpoints around Perth and Peel, I can advise that up until 2 a.m. this morning, West Australian Police have stopped 17,393 people since our lockdown began, with 166 refused passage. Another 49 vehicles at the Northern Territory land border were not permitted to enter WA due to a lack of suitable quarantining accommodation. I know this is frustrating for those people involved, but given the situation in the Northern Territory, we need to maintain strong border controls to keep our community safe, especially the Kimberley region. This morning I can confirm that WA has recorded 1 new local case of COVID-19 overnight, in addition to 3 new overseas cases in our hotel quarantining system. Just to repeat, we have recorded 1 new local case of COVID-19 designated case 1028. Case 1028 is a 37-year-old male. Our contact tracing team is currently interviewing case 1028. At this point, it's too early to say exactly how he acquired the virus. Currently, there are 2 possible scenarios. On Tuesday morning, June 22, he attended the Mobius Health and Performance Gym in Joondalup during the same exposure period as case 1022. In addition to this, he also attended that same gym on Saturday, June 26, during the same exposure period as case 1023. Case 1028 did the right thing and went and got tested and quarantined on Sunday, June 27. That test returned a negative result. He subsequently developed symptoms, was retested yesterday, and has now returned a positive result. As a result of this new case, anyone who visited or worked at the Mobius Health and Performance Gym in Joondalup since Tuesday, the 22nd until now, and has not yet been tested or contacted by WA Health needs to do so immediately. It is extremely important that you get tested immediately and follow all of the quarantine instructions. It's important to note that case 1028 has been in quarantine and was not expected to have been infectious in the community. This is encouraging news. It also shows the importance of the restrictions that have been in place since we reacted swiftly on Sunday. I can also confirm that as of 8 p.m. last night, a total of 310 close contacts have been identified in this community cluster, of which 205 have tested negative so far. In addition, a total of 2,199 casual contacts have been identified, of which 701 have tested negative so far. It is important to highlight that nearly 1,800 of the casual contacts have been picked up through our Safe WA app. This just reinforces how important the Safe WA app is. I encourage everyone to keep using the app or signing in wherever possible. It's important to remember the numbers of close and casual contacts will continue to rise as new cases are found and are interviewed by our expert contact tracing teams and new exposure sites are added. I'd like to remind every West Australian to keep checking the exposure sites listed online. They can be found at wa.gov.au and the Healthy WA website. New locations and times are added regularly, and it's important that everyone stays informed of the latest locations. I can also report that 18,255 tests were conducted yesterday, a record daily number of tests for Western Australia. That's a great number and is testament to Western Australians' to West Australians' dedication to doing the right thing. 43,675 tests have been done since Sunday, and we need to keep it up. In addition, we had 15,196 calls to the COVID hotline yesterday, a new record. We need as many West Australians as possible to get tested, whether they've been instructed to do so, have been to an exposure site, or are experiencing symptoms. The more people we get tested, the more confidence we can have when taking the next steps. Even if you've already returned a negative result and then develop symptoms, like case 1028, get tested again. I want to thank everyone for their patience. They are absolutely doing the right thing by getting tested. I can advise that we have additional testing capacity in the northern suburbs, including a number of drive-through clinics. I know there have been some long waits in the northern suburbs for testing. I want to thank everyone for their patience and for going out and getting tested. There is a wide range of testing locations available, and they're all listed online. It is a good reminder that there are other testing locations available around the metro area with shorter waits. Getting tested is one of the best ways to keep each other safe and get life back to normal as soon as possible. With regards to the Northern Territory gold mine outbreak, I can confirm the 175 mine workers who were tested in WA have all returned an initial negative test and are all undertaking 14 days of quarantine. They will all be required to be tested again. All other mine workers who did arrive in WA as close contacts have now left the state. These results are very pleasing, as we know this mine outbreak is currently causing significant problems in other jurisdictions around Australia. With regards to public schools, attendance was understandably down yesterday, similar to the lockdown last year. We want every child to get a good education. Education is an essential service, and our school staff are essential workers. Yesterday, 66% of students across Perth and Peel attended school, compared to 90% in the same week last year. There are understandably lower levels of attendance at those schools closer to the outbreak in the northern suburbs. Many people staying home and waiting for test results have school-aged children. Lockdowns are naturally frustrating and difficult for everyone, but they're necessary. I wouldn't do it if the health advice didn't say it was the best way to handle the current situation as quickly and effectively as possible. And hopefully in the future, as more West Australians get vaccinated, they will no longer be required. I know many West Australians' thoughts are on what next week will bring, what it means for school holidays, their employment, their businesses. The next couple of days will tell us a lot, and I hope to have more to say later this week as soon as we can. In the meantime, we just need to keep doing the right thing for each other, stay home if possible, stay safe, get tested, and importantly, get vaccinated. I'll now hand over to the Health Minister.
Thank you, Premier. Good morning, everyone. Can I begin today just with providing a shout out to all our great health staff who have been working on the front lines during this outbreak. Our health workers have been going above and beyond their normal roles. This includes the contact tracing teams, where we have over 100 people now working around the clock. Our testing clinics, which have been so busy. PathWest, which has been processing thousands of test results around the clock. The vaccination centres, which have really ramped up. In fact, can I thank everyone in our health system, particularly in our hospitals, where we're continuing to deal with unprecedented demand. You're all doing a great job. Yesterday was a very encouraging day on quite a few different levels. The fact we have only had one new related community case is encouraging. It appears we have caught case 1028's positive result very early on in his infection and while he was isolating. This is exactly why we have moved swiftly to try to stop the Delta outbreak in the northern suburbs as quickly as possible. But while I'm always optimistic, as you know, I'm always very cautious about COVID-19 because it is such an unpredictable and dangerous virus, particularly the Delta strain. So today is going to be another crucial day as we await the results of thousands of tests from yesterday. We all saw those long queues yesterday, so I want to thank everyone for their patience. I've heard that the testing clinics aren't as busy this morning, but please don't hesitate to get tested if you have any symptoms at all or have been to any of the exposure sites. Just on that point, can I just take you through, in particular, our clinics in the northern suburbs? As you'd all be aware, we have testing clinics at each of our major hospitals, including Royal Perth, Sir Charles Gardner, Fiona Stanley, St John of God Midland, Armidale and Rockingham Hospital. But in particular, in relation to our northern suburbs, we have a clinic at Joondalup Hospital, Edith Cowan Uni, we have a Western Diagnostic Pathology Clinic in Joondalup at WA Elcar Park, Joondalup. We also have another clinic at Joondalup Arena, corner of Moore Street and Wabbin Way. In addition to that, we have Australian Clinical Labs, one drive-through clinic in Wangara, 66 Prindiville Drive, as well as walk-in centres in Ocean Reef on 2 Prindiville Avenue and Mirrabooka at 37 Yerrigan Drive. I can also advise that we have drive-through clinics run by Clinipath at Mindari Marina, Anchorage Drive, Ocean Falls Boulevard, as well as Hocking, 21 East Road, Osborne Park, 310 Selby Street. And in addition to that, we have a range of other centres, and if you go to the Clinipath, Clinical Laboratory, Australian Clinical Labs and Western Diagnostic websites, they can provide you with the full details. In relation to vaccinations, what I also found encouraging from yesterday was the increased number of people getting vaccinated. And on the subject of records, in fact, yesterday was a record day for WA Health vaccination clinics. 7,645 people rolled up for WA, our biggest day ever, taking it now to 291,516 people that have been vaccinated at WA clinics. I can also advise that if we combine our GP and respiratory clinics, that takes the total yesterday to over 12,200. So we will crack the 700,000 mark for today, which is obviously a very pleasing result. So let's keep the momentum going, everyone. Despite the lockdown, yesterday was another big day for Safe WA. There were 1.2 million check-ins yesterday, and in the past week there has been 9.6 million check-ins utilising the apps. Scanning in takes no time at all, and it does make a difference. As the Premier said, of the 2,199 casual contacts of cases 1022, 1023 and 1028, 1,790 were identified by the Safe WA app. That is an important figure that reinforces just how important this app is. It is vitally important for helping our contact tracing teams who have done such an excellent job around the clock over the last few days. And finally, don't forget to practice good hygiene. Wear a mask. You are required to wear a mask outside the home, at all indoor settings, on public transport and outdoors at all times unless for vigorous exercise. Anyone who has travelled outside of the Perth metropolitan area and Peel region since Sunday must continue to wear face masks in public. If you are feeling unwell, or if you have been to an exposure site, please get tested and quarantine. The reason why we are in such a good position with case 1028 is because he did the right thing. So we must all make sure that we do the right thing, and together we will get through. What I might do is hand you back to the Premier for initial questions, and I'm happy to take any after that.
Thank you. Any questions?
Premier, should people under 40 get the AstraZeneca shot?
That's a very good question. What's occurred is the Commonwealth has made a decision to allow for that and provided a indemnity, if you like, for GPs who do that. The health advice we have is they shouldn't. So the health advice from the Chief Health Officer, indeed the national health advice from the Australian Technical Group on immunisation, otherwise known as a TARGI, is that that shouldn't happen. So clearly we get different advice, I suppose, or have a different approach to the Commonwealth.
Did the Prime Minister go against health advice by encouraging under 60s to go speak to their GPs about getting AstraZeneca?
Well, I can only advise what I've been advised by our Chief Health Officer, our health officials, and indeed the Australian Technical Advisory Group on Immunisation, otherwise known as a TARGI. They say it shouldn't happen. So there's obviously a different approach from by the Commonwealth to that advice. Now, as you know, with health advice, lots of doctors give you different advice at different points in time. But that's the advice we have, and that is the national advice from the immunisation experts. So clearly the Commonwealth has taken a different approach.
So who's advising the Prime Minister then?
I'm sorry?
Who's advising the
I
Prime
don't know
Minister?
the answer to that.
There's a big push for pharmacies to get involved both in the city and the country. Obviously that's something you would support. You've called for the floodgates to be opened.
I totally agree with that. Pharmacies should be issuing vaccines as soon as possible. Look, there's about, from memory, 600 or 700 pharmacies around Western Australia. Our understanding is that in July, around 50 pharmacies in more remote parts of the state will be able to start issuing AstraZeneca. So that will only apply to a certain cohort of the population. What I'd like to see is pharmacies given a greater opportunity to vaccinate people around the state. They currently do a flu vaccine. I think as a country, we just need to get more opportunities for people to get vaccinated with the vaccine that is appropriate for their age group. We just need to open up more to allow for it. Otherwise, what's occurred in Sydney and is occurring here and is occurring in Brisbane and Northern Territory and other places will continue to happen over the next 6 months to a year. And so the sooner we get people vaccinated, the better. So, you know, my view is over 60s should be made eligible for Pfizer. We should open up our vaccines availability to more and more both GPs and pharmacies to issue it. We're advised that additional supplies will come online in the course of the next month or so. We just need to get people vaccinated.
So the advice from the WA government...
I'm sorry, Eliza?
So the advice from the WA government today is under 40s, wait for the Pfizer, don't get the AstraZeneca jab.
That's the health advice we have.
Do you know how many AstraZeneca jabs occurred in those younger cohorts yesterday or before?
No, I don't know, I'm sorry.
Queensland has said that it's going to be running out of Pfizer, I believe, by around Monday. Do you know the current stocks in WA? Are they satisfactory?
I'll let the Health Minister answer that in a moment.
Three cases from overseas arrivals. Obviously still presenting a problem.
Yeah, the 3 cases, new international cases today, from various African countries. One from Zimbabwe, I think the other may have been from Congo, South Africa. What's occurring is a lot of Australians, and this is the Queensland example as well, a lot of Australians are going overseas for various reasons. Some of them work-related. And as we know, Australians have been allowed to leave for conferences, for study, for compassionate reasons, for work reasons. And tens of thousands, in fact, best part of 100,000, have left Australia over the course of the last 18 months for those sorts of reasons. Now, some reasons are legitimate. Some are legitimate. But the vast majority of people going overseas, in my view, shouldn't have. They should stay home while there's a pandemic running wild around the world, because inevitably they want to come back. And when they come back, some of them will be positive. And then they displace others who have been waiting overseas to get back, who didn't go overseas in the last 18 months. So there's a real problem we face here, that too many people still are going overseas for various reasons. Now, our economy within Australia is incredibly strong. In fact, today I was meant to be hosting a skills summit with a bunch of businesses here or a huge number of people here in Western Australia to discuss skills shortages and what we do about it. It just strikes me as odd that lots of people are going overseas for work in the middle of a pandemic to pandemic-ridden countries while we have skill shortages here in Western Australia. And I think we need to take a much tougher approach with people going overseas, particularly to COVID-ridden countries, and then bringing it home. And the Queensland example is an example of that. I think, you know, people going to countries overseas who might be FIFO workers, you know, we have lots of opportunities for work for those people here. And then going overseas and catching COVID and then bringing it back is just, frankly, the time for that is over.
Is that what's happened with these 3 new hotel
Don't know
quarantines?
the exact situation. I'm advised at least one that is the case, but we're following up. But the Brisbane example, I was talking to the Queensland Premier this morning. The person out of Brisbane, who's been going back and forth to Indonesia, flies helicopters, I understand. I mean, they basically go up to Indonesia, catch COVID, bring it back, go into a hotel, displace someone else, and then potentially spread it. It's got to stop. Until we're all vaccinated, that sort of thing has to stop.
Do you know roughly or have an estimate of how many people are coming into WA each week from high-risk countries?
No, basically we don't have exact figures on that. We have 530 or so people per week coming into Western Australia. Where they're coming from is all over the world, but the 3 positive cases today came out of countries in Africa, South Africa and Zimbabwe. As you recall, 3 months ago, India was the country where most positives were coming from. That is diminished for a few reasons. One is India has got it better under control. Secondly, there's a testing regime that is very robust before people board aircraft and come back. So certainly for anyone going overseas, at this point in time, if there is a legitimate reason, they should be vaccinated before they go. That should be a minimum. But I think we should crack down on the number of Australians going overseas, keep it to a minimum until our community is vaccinated. Otherwise, they're just displacing other Australians overseas coming home, and we're running the risk of COVID spreading and leaking out of our hotel quarantine system.
Just on the mobile workforce, there seems to be a bit of anger among the FIFO workforce. There seems to be some inconsistencies. Some miners are not being allowed to return while others are actually flying out to mine sites. Is that just the way it is?
Yeah, look, we don't control that exactly. We're working with the mining industry to make sure that people aren't leaving the city who might be positive, and requesting people who are currently on site have a longer swing, at least until Friday. If we could come out of this on Friday night, a lot of these problems will be resolved, but that will
depend upon positive cases over the next few days and the number of tests we conduct.
Yeah, but given all the confusion over the vaccine rollout, the states are saying one thing and the Prime Minister's saying something else. How badly is the Commonwealth stuffed up the rollout?
Look, I know it's a difficult thing. It's never been done before, a vaccine like this all over Australia in the height of a pandemic. So I don't want to be too negative about it. All I'd say is we just need to open up to more outlets for people to get vaccinated, GPs, pharmacies, as quickly as possible, and we need to allow people over 60 to get Pfizer. There's huge hesitancy amongst people over 60, and I understand that. For those of us who have had the first AZ jab, I'd recommend you get your second AZ jab. I'm going to get my second AZ jab shortly. But for people over 60, we just need to open up to Pfizer as soon as we can.
The vaccination rate has not gone above 10,000 per day. Some of the viewers are concerned about that, and they're asking, is there a capacity in the system to get above the rate so we can increase the pace of the rollout?
The vaccine rollout is growing every day. So as Roger Cook outlined just before, we had record vaccines issued yesterday through state clinics, but that's only one aspect. There's also the Commonwealth rollout. So we're now at over 550,000 first vaccines being issued in Western Australia, but I'd like to see it grow. So I'll just make it plain. I just want to see it grow. I just want to see everyone given access as soon as we can to vaccines. Now look, our supplies obviously are limited, but every bit of advice we get is that in the course of the next month, certainly by the end of July, there'll be large supplies of Pfizer coming in. And what's the point of hoarding it anyway?
what's the point of hoarding your supplies? We've got to vaccinate people anyway. Just get people vaccinated, particularly the more vulnerable categories. Over 60s, people over 60 are more vulnerable. We know they are. The death rates overseas of people over 60 are much higher than people under 60. So just get them vaccinated. If that means giving them access to Pfizer, well then just do it.
So on the
Well,
border
that's
issue,
being made on the business reports, then is there going to be some kind of special category for tourism operators?
Yeah, we're working on that. Obviously, Cabinet hasn't met, and secondly, we haven't made a final decision on the end of lockdown on Friday night. We won't be able to make that decision till sometime during Friday, so we don't know how long this is going for at this point in time. So that will colour what we do. So that's why we have to wait until at least Friday night before we can begin to make any sort of decision. In terms of what the regime will be, we'll be able to advise you sometime, I expect, next week.
Are you disappointed in...
Says the Pilbara has the lowest vaccination rate in the state, just 2.5% compared to the state average of 6.4%. How disappointing is that, considering there are so many vulnerable communities up there?
There's hesitancy amongst remote Aboriginal communities, and we need to really target getting that hesitancy removed and getting Aboriginal people vaccinated. As we know, Aboriginal people, as we learnt in 1919 in the Spanish influenza outbreak, are very, very vulnerable. And so a campaign, a program to get regional people, Aboriginal people vaccinated is essential. I actually think, it would be money well spent on a very, very large advertising campaign around Australia to encourage people to get vaccinated, particularly in regional WA and particularly in Aboriginal communities.
Just on the one new case, are you categorising that as good news or concerning news?
Well, no case is good news, but it is encouraging that he was picked up by the testing regime and that he was in quarantine when he was found to be positive. So he was tested and found negative. He went into quarantine and a subsequent test when he developed symptoms found him to be positive. So our expectation is, whilst he was in the community, he was not contagious. So that is encouraging news.
Has the Mobius gym been fully deeply cleaned? Is it back open? Do you know the status of
I
that?
don't know. Maybe the health minister will know. I don't think we know.
Has
On
the
the issue-
CCTV been reviewed at the Indian Ocean Brewery for case
I
1024?
don't know the answer to that either. Maybe the health minister knows that.
Are you disappointed with the number of students attending school this week, down from 90% to 66%?
Well, it's understandable. It's 66%, and I'll give you a couple of statistics which I think are quite interesting about that. If you have a look at Quinns Beach Primary School up in the northern suburbs in the vicinity where the outbreak has occurred, school attendance yesterday was 42%. Bull Creek Primary School in the southern suburbs, attendance was 80%. So parents are obviously making decisions based upon where they live. I fully understand that.
on the issue of, just very quickly, how many percentage of people you reckon in Western Australia or in Australia has to be vaccinated before the border policy comes down where we don't need borders anymore, in your opinion?
International borders.
Local, and it comes, no, interstate borders.
We only put up interstate borders when there's positive cases. It's not. It's a tricky one, interstate borders, as we learnt from the Clive Palmer case before the High Court. States can use borders to protect themselves, which was a good judgment. That gives us that capacity, and I know states all over the country are using it currently. I think more about international borders and them coming down. I think it won't be till next year sometime, and I think we'll need way above 80% vaccination for that to occur. And that's why we're saying to people, get vaccinated. If you ever want to go and see your relatives overseas or go on an overseas holiday again, we just have to get people vaccinated as soon as we can. That's why I keep saying, open the floodgates to get as many people vaccinated as possible. Don't hoard the vaccines, in particular Pfizer. Just get more vulnerable groups of people vaccinated as soon as we can.
I mean, it wouldn't be a footy. It wouldn't be a question. It wouldn't be a presser without a footy.
AFL?
A footy. no. Footy players not wearing masks correctly.
Look, I saw the photo. I don't think what they've done is any great offence. I understand that people make mistakes. I just urge them to wear the mask properly. It's not like they've done a Barnaby Joyce. I think they've made a mistake, and I think they should just wear it properly in the future.
Are you reconsidering?
I don't think they've done a Barnaby Joyce in many ways.
Are you reconsidering the South Australia border?
Saying someone's done a Barnaby Joyce could mean many things.
Yes.
Are you reconsidering the South Australia border, given that there's?
Yeah, we're monitoring. That's a good question. We're monitoring South Australia. They've had some cases out of the gold mine in the Northern Territory. We understand at this point in time they're all in the one house and they're quarantining, but during the course of today and tomorrow we'll monitor that, see what happens as to whether or not we need to do anything further with South Australia. The great irony at the moment is I don't think Victoria's got any cases, does it? Has any come out of Sydney?
One local.
There you go. So Tasmania doesn't have any cases, and perhaps the ACT, that's the only places at the moment.
Just on Queensland, given that the 19-year-old and her brother were infected sort of 10 days in the community, is WA now having to backdate the requirements for quarantine?
I'll let Roger answer that.
Sure.
I don't know the answer.
Just back to
the
the
holidays are next week, obviously. What's the likelihood that people in Perth will be able to travel to the regions from Saturday morning?
Yeah, that all depends upon how many people are tested in coming days and how many positive cases we get, and whether or not those positive cases have been in isolation. So, all depending upon those factors. So if you're unwell, get tested. If you have been to any of the exposure sites, get tested. If you've met anyone who has been to those sites, get tested. And that will give us the confidence to make a decision on Friday. I realise people want to make bookings and they want to make plans. I've got kids, I understand that full well. But until Friday, we can't make that judgment call.
Some retailers are trading today. They shouldn't be, should they?
All depends what they're selling. So the rules we issued sort of locked down some businesses, for instance, nail salons, hairdressers, personal contact businesses. Other businesses are able to open, for instance, essential supplies and the like, and that's a broad definition. I don't think the police are going to take a heavy-handed approach on this. I've spoken to the police commissioner about it. He doesn't want to be, have police officers going in and arresting people or locking down shops or whatever. We rely upon the innate common sense of West Australians to do the right thing.
Furniture retailer, electrical retailer is trading. Would that fall within that province?
Who are they, sorry?
Harvey
Do they
Norman.
sell other products?
Harvey Norman.
Yeah. Well, they don't fall within the... I don't think they would be considered to be essential at this point in time. And so therefore, I'd urge them to look at the rules and comply with them.
Just back on the AstraZeneca debate, what would your advice be to someone who is under 40, wants to get vaccinated? Should they go see their GP to make that request?
Well, it's an individual choice. That's what the Prime Minister has said. But our health advice is they shouldn't do it. So I can only advise you what our doctors say. As you know, doctors, get 10 doctors, you're probably going to get 10 opinions. But our doctors, and indeed the national body that gives you advice on these things, they say that under 40s shouldn't have it.
And can you just explain why they're saying under 40 shouldn't have it?
It's the risk of clotting. So, I've seen in the newspaper, in fact, I've seen many front pages about this, and with even pictures of clots. The advice is it's the risk of clotting. So that's the health advice that we have. I've had my first AZ. I'm obviously in a different age category to the under 40s, but I've had my first AZ, as has Roger. We'll both get our second AZ. Your second AZ is extremely low risk, and I don't think there's any concern about that. But what they're saying is under 60s, if you haven't had your first dose, well then you should not get AZ.
Yesterday you mentioned that there was levelled restrictions, so we're in level 3, I think. Is that right? That suggests that we're moving towards a more standardised approach, which you've previously been wary of. What kind of changed that, and are those levels published anywhere?
I don't think so. What we've done over the last 18 months is obviously refined what we do, and depending upon circumstances, we've just broadly termed it level 1, 2 or 3. But still within those, you can take things out or insert things, which is what we did the other day when we made this call. Again, I can't remember which day it was, I think it was Monday. when we made this call. The restrictions we put in place are broadly consistent with the lockdown restrictions we put in place earlier this year and early last year. So it's just it's just a term really, calling it level 3.
Broadly speaking, can you kind of tell us what level 2 means? Does it, what it mean removing?
Roger might recall, but I don't have a piece of paper here with me. But what you do is, on Friday night, if everything is going well, we may ease off restrictions back to what they were last week. We might step down in other ways, or we might go to none. It all depends upon the advice we receive on Friday.
Is it fair to say masks are here to stay for at least another week on top of that?
Natalie, I don't know the answer to that at this point in time. Obviously, masks are annoying, but I do know that people are marvellously good about wearing them. I mean, I went to a coffee shop. This is always my story. I went to a coffee shop this morning to get a takeaway coffee, and it was everyone who was there was wearing a mask, same as yesterday.
New South Wales have announced that they're mandating QR code check-ins for all workplaces, including offices. Is that something that you're thinking about?
We already have very strong QR. So I think Western Australia is the first state to bring in the QR codes, and we already have it very extensively across the community. If we need to expand that, we will. I don't think we currently have it for workplaces, because what you often find in workplaces is it's recorded who goes to work, and we actually have pretty good systems to record who goes to work. So workplaces have very good systems about it that might even be better than the QR code. So look, we'll get some advice on that as to whether we need to expand it. Obviously, QR codes might not be as good as the existing systems. For instance, when I go to the West, I have to sign in. You know exactly who comes in and out at any point in time, which is better than a QR code system. So many workplaces have that already.
So very quickly before we get off stage, has the police access on the Safe WA app, has that issue been fixed yet, or we're still waiting for it?
Yes, we passed legislation through the Parliament. We didn't actually see any drop in the usage of the Safe WA app out of that. As you know, the police accessed the system twice to track down a murderer and to track down an alleged murderer, and to track down an alleged committer of a grievous bodily harm offence, and to find out who the witnesses may have been. But we didn't see any drop-off in the usage of the Safe WA app as a result of that information.
Could I ask you also your best guess, just on retailers, would you put Officeworks in the Harvey Norman category, that they should not be trading? Because I understand one of their stores has been closed, another one is trading.
Yeah, they may be considered a bit more in the essential category as opposed to non-essential. But again, we just exercise common sense. So, for instance, Target, which doesn't provide food, but it provides a whole lot of goods that people might need to function in their homes. Bunnings is the same. I think Officeworks. You asked me to get into definitions about what various people regard as essential. Some people regard, electronics as essential. Others don't. My children would say electronics are essential. I'd probably say they're not.
If it's difficult for you, it must be more difficult for them.
For my children?
No, well, no, sorry, no. For Officeworks and Harvey Norman and some of those others.
Very difficult. Sorry, Jeff?
No, if it's difficult for you, it must be difficult for the retailers to know whether they can or can't open their doors.
Yeah, it is. So we're not adopting a heavy-handed approach, but I just urge everyone to do the right thing. Thank you. I'll let Roger answer your specific questions.
Roger, so just before we take questions, so Jeff, to your question, the announcement we made the other day is that retail is permitted, but only for essential health services and essential goods such as supermarkets, pharmacies, hardware, petrol and others.
So an Xbox doesn't cut it?
An Xbox wouldn't cut it, but perhaps sanitisers and other office cleaning equipment may cut it. So it's and as the Premier said, we police these with a light touch just to make sure that common sense prevails.
Can I ask, and with the greatest of respect to 1022, would she be considered a super spreader now?
Look, potentially not a super spreader. I think there was a question that Peter was going to ask earlier about the nature of the contact. with between 1022, 1023 and 1028. So what we can advise is that there was significant contact between 1022 and 1028 of about 5 minutes at the gym, and then there was about a 45-minute contact between 1023 and 1028 on the 26th of June. Now, we don't know what the transmission event was, because obviously there's two, and it's difficult to say to say in relation to what did the trick, but this wasn't a case of fleeting contact.
Do you know the status of the Mobius gym? Has it been deep cleaned? Is it reopened? Do you know any of that detail?
They'll be obviously advised by the WA Health Department in relation to what steps they expect to take in terms of being able to reopen again. The fomides don't last that long in relation to equipment and so forth, but you'd expect them to undertake a deep clean of the facility before they took customers again.
So in the case that 1028, this new case, potentially was using just the same room or the same equipment, or was he actually a client of the physiotherapist?
Look, the way it was characterised to me is that they were doing workouts together.
So do we know the nature of the contact between 1022, 1023 and 1024 now? And have you checked the CCTV?
Yeah, I certainly haven't seen the CCTV. That's still in the hands of the contact tracers and WA Police. So I can't provide you any more details in relation to that. That's been described as fleeting contact, very different from the situation in relation to 1028.
Why is it taking so long to review this? Surely it's just a matter of kind of tracking.
Oh look, the only reason, Hamish, might be that the Premier and I haven't been informed yet about the detail of that work. Not all information comes to us, but if we can provide you with that information, we will. So there was another question, I think, from you, Eliza, with relation to Pfizer stocks. So at the moment, we have 110,000 doses of Pfizer in stock, and we're receiving around about 32,000 a week at the moment to the end of July. We currently have 220,000 Pfizer bookings at community vax clinics until the end of July. So the way we manage this is to make sure that we don't run short in the event that someone needs their second dose. We're encouraged to expect a significant increase in the number of Pfizer that are available from early August, but we haven't got any advice yet as to what those actual numbers may be.
Does the Perth Children's Hospital have the capacity to provide care? I mean, if there are children that catch the Delta strain of COVID, because some of viewers are asking that, consider that they have closed Ward 2B during the height of COVID last year.
We do. We've recently opened an extra 20 beds at PCH. That's obviously to deal with the high demand that the entire hospital system is experiencing at the moment. In fact, hospitals right up and down the East Coast are experiencing as well. As advised earlier in the week, we've cancelled non-urgent Category 2 and all Category 3 operations to make sure that all hospitals have the capacity to receive any influx of patients in relation to COVID-19.
Minister, with those light queues at the pop-ups, the pop-up testing clinics up in the northern suburbs, very few people at them this morning. How do you explain that? Would that suggest that everyone who has been to any of those exposure sites have now all got themselves tested and there's no one else to get tested?
Well, I certainly hope that's the case, Jeff, but what I would say to the people of Western Australia is that if you're experiencing any symptoms, please get yourself tested, regardless of where you live. But in particular, if you're in the northern suburbs and you've been to any of those exposure sites, and those sites are on the wa.gov.au website or the Healthy WA website, have a look at those. If you've been to any of those places, please get tested. Now, the fact that we had, I think, some 18,000 people tested yesterday would suggest that people have been heeding the call and making sure that they're doing everything they can to do the right thing. But if there is anyone else out there, you can get tested today. Anecdotally, we hear that they are less busy, and we want everyone to do the right thing.
So what is the...
break down the close contacts and casual contacts for each of the three cases? I think we've only heard a cumulative figure so far.
Sure. I can give them to you as of 8 p.m. last night.
Yeah.
For case 1022, we have 189 close contacts and 1,043 casual contacts. For case 01023, we have 57 close contacts and 93 casual contacts. For case 01024, we have 64 close contacts and 1,063 casual contacts. We don't have any details for 1028 because obviously that was an overnight case.
What's your reaction to hearing that the Pilbara has such low vaccination rates?
Look, it is concerning, and I recently went through the Pilbara, did some radio interviews and other media in relation to vaccination rates. What was raised with me is that there is an element of vaccine hesitancy right across the regional communities, but in particular in Aboriginal communities. So we need to continue to work with our Aboriginal medical services and ensure that everyone has all the information they need to make the right decisions. Look, this is so important. Right across Western Australia, it doesn't matter if you live in a remote or regional community or in the heart of Perth. Everyone has to get vaccinated because if we're not safe until we're all safe. And it's really important that you take the opportunity to protect yourself, your family and your community.
So what is the nursing and medical workforce and PPE supply plans for a COVID outbreak if it becomes uncontainable here in Western Australia? If it ever does, is there a PPE plan at all?
There is a PPE plan. We have significant stocks of personal protection equipment on hand at the moment, running to some 5 warehouses. We've got significant supplies of PPE.
Just quickly on 1028, is there any indication that they went anywhere else from the time that they were infected at Mobius? So are we expecting exposure sites from them to grow?
No, not at all. We're not expecting any exposure sites as a result of 1028. So the series of events are that 1028 was either infected on the 22nd of June or the 26th of June. But when we tested them on the 27th of June, he was negative. Okay. So we know that he was isolating at least from the 27th of June. So he will continue to enjoy the company of his own unit, and from that perspective won't represent a significant risk to the community.
Just on the record vaccination day, 7,645 doses administered yesterday. Do you have a breakdown on how many were AZ, how many were Pfizer?
No, look, I don't. I'm sorry. I'm happy to provide that, Peter, but just repeating those numbers. So right across the state yesterday, we had 12,242. That's combining the state facilities and the GP networks and the respiratory clinics. 9,840 of those were in the metropolitan area and 2,402 were in regional Western Australia. So that takes us over 700,000 now, and just to focus on those, which is important, with over 130,000 now fully vaccinated. That's still low numbers. That's I think between 6 and 7%. We need to continue to do more to make sure we get everyone vaccinated.
Given the delay of the Delta strain, how long it took to basically infect the person, will those people that get tested negative tested again just to be safe and sure?
Look, my understanding is if you're a close contact, you have to quarantine and get tested a couple of times during that period. If you're a casual contact, you only have to get tested once and isolate until you receive a negative result.
Are you happy, just quickly, sorry, are you happy with the advertising marketing campaign behind the vaccine rollout, the rollout for WA, and is it going to be ramped up as we get more stocks?
Look, I think the rollout for WA campaign is effective. I think tells an important story, and people find it engaging. The Commonwealth one, not so much. I think it's pretty tepid. But look, I think we need to actually make sure that there's a call to arms to everyone in Australia. You have to make sure that you get yourself vaccinated. If you want to continue to travel, if you want to make sure that we avoid lockdowns, there's only one way out of that, and that is to everyone get vaccinated. We're not safe until we're all safe. Thanks very much, everyone.
Thank you very much.
Yeah, thanks.